Last time we discussed about the assessment and the management of burn, and you have written assignment, and you can see from your assignment as per I have taken one class of management and the assessment. I hope so everyone will know that what is the error, whatever you have drafted in the assignment paper. So in yesterday I have checked out in details about the burn topic from the question paper and from the syllabus. When we look into the syllabus, looks very simple and nothing, okay? But if we really check out the question paper, it's really, some complicated. So you have to read and write in each corner you have to find out. Simply they are asking for the 5 marks of the burn complications, then how do you draft it, then nursing means the health worker team in the burn patients, okay, rule of 9, fluid resuscitation. There is a small, and we always trying to neglect in that way, and generally we used to read, okay. So you have to be careful and to go in the corner, like example, so not 50% of burn or 60% of burn. How you are going to draft in the exam? Just look at into the syllabus. It looks very easy, then how you are going to draft based on the 50% or the 60% or 70% of burn patients? From where you are going to start is very important, no? So how you are going to give answer if there is a 60% of burn in short note, 5 marks? How you are going to start? Yes, anyone? How you are going to start? Please tell me.
Ma'am, definition, causes, risk factors,
5% of burn?
management, answer.
Huh? If they ask 5% of burn, and how you are going to start with your this causes and all? See, that's why it's very important, the drafting and the way you are going to write. See, first of all, you are going to do the assessment. Yes or no? One patient, there is
Yes, ma'am.
one scenario, 60% burn. When you posted in casualty, the healthcare worker team or maybe the patient's relative brought to casualty. What you supposed to do first of all? Hmm? The same thing, the examiner wants to know that how much you expert and how you are going to expertise your question answer. And you are getting that burn patient that is 50 or the 60% burn in your hand. What you are going to do? First of all, you are going to start your assessment, no? Yes. Primary, secondary assessment you have to do. In the primary assessment, A, B, C, D, E, F till you have to do. Okay? Then in the primary, secondary assessment, before that only how much degree it's burned, the situation you have to see immediately. So practically, if we discuss, we have to, check the vitals, then saturation, then first of all, surely we are going to see based on the patient's data, this one, how much the patients are conscious. Understood? This is very important. That's why you have to be, you don't have chance to get a clinical posting over here. Okay. So if they give scenario, it's very easy to draft based on the scenario. Or if they elaborate, you write the causes of or the types of burn or the nursing management, the 50% burn is easy. But if they just uh, mention that 60% of burn in your hand, how you are going to elaborate? Okay, that's why the assessment, don't forget how much degree. Okay, first you have to find out, then the 9 of rule, then the primary secondary survey. Okay, then in the primary A, B, C, D, E, F till the fluid resuscitation in the 50%, you have to calculate. After calculating, you have to know that how much fluid has to be infused to the patients, and The half of the fluid has to be replaced during the 8 hours. Okay, then the remaining fluid after this rest of the fluid has to be covered the next 16 hours. So you have to be in that way. Okay, that's why in the question paper, you look at question paper, and we do not know that all the question paper has going to be repeat or not also. But after seeing the question paper, you are you will have some concept and knowledge that how to study. Okay, this is burn part is very different from the others unit. Okay, are you getting me? Yes.
Yes, ma'am.
Okay, only the burn team, so not burn team. How you are going to elaborate? Then this complication of burn. Telling complication of burn, generally we know that, but you will not get marks again. Then what is the pathophysiology of burn? Or maybe the sort of physiological changes of burn without telling any percentage or nothing. How? Okay, so you try to read from the its corner, don't leave any part. Okay, see the question paper and this one, read it, then try to take the concept from the each angle. That's why if they ask anything, then from there you can give answer. So now we will start class. Today topic is we will discuss about complication of burn. And before that, I hope all of you understand what is the anatomy and physiology of the skin. Okay, it's very easy part for you. I know that you know very well. But since we are going to discuss on the complication of the burn, just we will revise the skin part. The skin is the largest body organ. Okay, 15% of body weight. It is not a passive organ. Okay, what is the function by skin in our body? It's protect the underlying tissue from the injury. Okay, it's covering. Then it's temperature regulation, act as the water like tight seal, keeping body fluids in the body. And it's the sensory organs. We all know that if touching in my skin, okay, if the sweat is coming, and then we have the sensation, if someone touch, that is a pain. The temperature, we came to know that this is hot and cold. Okay, these all are doing by the skin. And we have two layers, epidermis and dermis. And the epidermis is the outer layer of the skin. Okay, act as the protection and the tight shields in the body. Only the epidermis is capable of the true regenerations. Okay, you can see this, sorry, and this slide is not much clear. You can see the epidermis in the violet color, then the brown, this little light brown, this is dermis, and the yellow part is the subcutaneous. Okay, then the down part is the muscle, and the hair root is present here. And that's why if you know the anatomy and physiology of the skin, then it's easily can assess from the burn patients how deeply is happened this burn. Okay, and what is the stages. Okay, all of you understand? Yes or no? Yes, please give me answer, otherwise it's very difficult with.
Yes, ma'am.
Please give response. Okay, so first we will start complication of burn. How many of you understand what are the complication of burn? Indrani, why do we need to discuss of burn, complication of burn? Why do we need to discuss about the burn complications? You have any concept?
Ma'am, because treatment of burn requires more care. It may develop into hospital infection also and bed sores also.
Yes. So burn can be affected, the multidisciplinary organs can be affected and can lead to death. Why? Why it's affected? Because it's lots of seriously metabolic changes in our body. Because of the metabolic changes, it may be affected in the kidney or lungs or in the heart. Okay? So that's why It's very important complication of burn. If we have the concept, because of the burn, patients may lead to these kinds of problem, so that we can take up the, you know, we can take up the case very soon, and we will have the alert mode. So during the course of management of burn, patients may develop the severe complications. So as per the book, this I have written from I have taken from the Dr. Sima Rekha Devi book. Okay, this is very simple, and she's practically practicing in the hospital, and she has divided into the local and general in the complication. So if you want to read from the other books, no problem, and you can take the concept from this slide also. Okay, so complication of burn are divided into the local and general. So first of all, we will discuss what is the local complications. So open wound with a repeated graft loss. Okay, why it's repeated graft loss? After the surgery, we are not giving the proper information, or we are not taking care of the patients properly, and we are not immobilize the patients and simply lying down on the bed on keeping, not changing the position. And because of that, the wound can be skin graft, maybe repeatedly infections, or maybe it's become open wound. Hematoma and bleeding under the graft, the same thing. We are not mobilized problem. We are not mobilized the patients properly. Okay, then we don't take care, and how to keep those are not maintaining. Because of that, hematoma and the bleeding under the graft can be occur. Then the recurrent infections. Then after the grafting or during the burn injury, we need to maintain the sterile technique. We have to wash hand before touching the skin or before and after. And we have, because they are immunocompromised and high risk of infections to the burn patients, and the skins are the protective layer, and whatever the protection supposed to be provided in our body, it's already burned out. And the evaporate the water from the body, cannot prevent. That's why we need to be more protections and more precautions. We want to prevent from the infections of the patients, and we don't want to become the life threatening condition in the future. Okay, unhealed donor site, uh, that also very important. Before that also, we need to be, you know taking care of the skin, where we are going to graft, and the grafting part, how do we do dressing. Regular dressing should be done, and we have to assess regular skin condition. Okay, then what all antibiotic or any ointment has to be applied, and how to cover it, when it has to be open, when it has to be closed. Those things we have to be maintained. Then the donor site also become a healed, most probably, if we are taking care. And the necrotizing facilities is the another, but rare but the serious complications. you know uh, why the burn patients, we need nutrition, good diet, then the fluid resuscitation, then the antibiotic therapy. This all has to be performed in time. If we had given the proper treatment in time, then we can save the persons, and we can make it heal properly in the futures without getting any complications. That's why the local complications, if we are treated well, if we know that how to tackle up the situations, we have to taking care of the wound, not only the burn and the grafting part. Then we have to investigate, we have to do the investigation properly about the blood serum electrolyte, then CBC all count, we have to check it out. And then we have to give the good diet to the patients, as well as we have to calculate the fluid resuscitation during this period. Okay, so if we taking care, then we can prevent from these local infections. Are you getting me? Yes?
Yes, ma'am.
So
Yes,
you,
ma'am.
okay, so when you write in the exam time, so you can, this will be the subtopic, subheading, then you can put few point shortly, okay, so you can drop it in this way. And now we will discuss in the general condition, general complication. The patients are lying down or the patients are lengthy hospitalized since the patient's skin or maybe the burn area are not healing. What happened? Then the persons are lying down on the bed for the lengthy time. Then the patients may get complication of pressure sore on top of that burn. Okay. Not only the pressure sore we all understood. Sometimes telling by mouth is very easy, but handling the patients are not job. And sometimes patients may not cooperate, then sometimes because of the pain patients are not healing. But even though we are the front line worker and we want to prevent from the any further complication, and we have to give the counseling and we have to motivate the patients. If the patient is having pain also, we have to administer analgesic and turn the patients 1 hourly or 2 hourly or maybe 3 hourly, and we have to support, and we have to the burn area should be exposed and make it to dry, and whatever the antimicrobial is given or returned for the ointment or anything should be applied properly. This is our responsibility to reduce from the pressure sore. Okay, but this is the main part of becoming uh, pressure sore in the burn patients. Okay, then the next is the margolin ulcer. You can see, you will see from the slide, like these burn patients we are treating, but it's not adequate. What we are treated are not adequate. There is no chance to get healing. That's why that its part is becoming ulcerated with the thick of muscles. Okay, so you will see from the next slide. Then the renal failure, if metabolic correction, if we are not taking care and if we don't do this one in time, then the renal failure is the high risk in burn patients. Okay, that also in the next slide I will show you some few points. Then heterotopic bone formations and the multiple organ failure, then the patient can lead to death. Okay, so this we'll see one by one slide. Marjolin ulcer, see? Can you see from the slide? Yes or no?
Yes, ma'am.
This is the Marjolin ulcer. Taking care of the patients, but because of the immune or maybe because of the lacking of adequate treatment, then the persons are become this way. Okay. The next slide is heterotopic bone formation. In the this one, like I hope so. Some of you have seen in the OPD basis or maybe in the casualty also, like burn in the joint area. Then because of the pain, we are not moving, just applying the oil and not performing any this one rehab. Sorry, the exercise and all, and day by day is becoming in this condition. Can you see the slide? Okay, the joint, it's this is the normal joint, and can you see the this joint is becomes totally straight, and no bending, no flexion, no extension type. Can you see? Yes or no?
Yes, ma'am.
Yeah, this is the okay, this is the condition are become to the patients. That's why we need a team of health worker. Physiotherapy has to do the exercise. We need the physiotherapy, we need the nurses, we need the surgeon, we need the anesthesiology, and we need the intensive care unit. So based on the patient's condition, we need to expose to any area, and we also need to form the team of maintaining those kinds of complications. Okay. The renal failure, once the person's renal failure, if we diagnose, okay, the conservative treatment should be started, the mainly diuretic if there is edema. That's why we always, there is a Parkland formula, there is a formula is there, we have to calculate, and even the fluid we are divided, how to give during the 8 hours and later on how much we have to be infused, as well as we need to check for the output, how much urine output is there. Then we should know that how much ml per hour has to be maintained output. If not maintaining, then what we have to take up the case. Okay, the normal. So if how much we infuse, keep on infusing, and if urine is not output is not adequate, it's not coming out, that means a fluid retention are there. Okay, so in this case, the conservative treatment are started with the diuretic. Okay, so we can send for the blood electrolyte, then from the serum electrolyte we can see how much potassium level, then how much sugar level, how much the sodium level, then bicarbonate, calcium chloride, or this is totally deteriorated and altered, then we need to make the correction. Okay, then suddenly patients become renal failure, because this is not the negligence part. Time to time we are handling, time to means situation to situation we are tackle up, but some are not lucky enough, and then doing another case, and coincidentally it's suddenly, that is nobody planned that the burn patient should let it be the renal, nothing like that, but it's coincidentally, it's sometimes it's this all the serum electrolyte, then the metabolism are totally changed. Then we need for, if we are ruled out, then we will know that what else has to be correction. If correction is not going to be possible because urea creatinine is very high, then we have to do kidney dialysis. Okay. So some viewpoint with the criteria for the hemodialysis in burn patients. If 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 the patient is a chance for hemodialysis. So what is the criteria? Blood urea nitrogen more than 70 mg per deciliter, creatinine above 5 or the potassium above 6, then pulmonary. If the pulmonary edema is very seriously, then hemodialysis. Okay, then systemic signs of uremia, then we need to do dialysis. Okay, these all complications, please you make it notes. Okay, so from this view you can explain if in case if they ask complication of burn. See, the renal failure, once the persons become renal failure, then according to the serum electrolyte we are trying to rule out. According to the result, we may do the correction. If not possible, then we will do for the hemodialysis. Okay. So what is the criteria you understood now? You can see from the slide. You have seen already. And now the mortality increase with the multiple organ failure, like sometimes this is we can consider as a physiological changes. So sometimes they ask only the physiological changes in burn patients, 2 marks. Understood? So what is the changes we can see from the previous slide? What are the complications in the local and the general? Because the skin have the multidisciplinary action has taken in our body. So when it's burned, maybe in the epidermis or the dermis. Once the epidermis is not serious, epidermis up to the subcutaneous, what all are present? Cell, then tissue, hair root, the artery and vein. That's why the contraction is occur, no? Okay, so we need to alert. if burn along with the nerve as well as artery and the vein, so obviously the hemodynamic will be failure. So what we have to do, first of all, we are infuse the crystalloid, then the second is the colloid, then after the colloid we are trying to see the blood CBC, whether we need to transfuse blood or not. Okay, so but we have to know that physiological, what are the physiological changes, that is the hemodynamic failure. So if we treat it, if we taking care in time, then those things can be prevented. Then the pulmonary failure, just now also we discussed in the hemodialysis, this is the high chance, you know. Then the intestinal failure, okay, the liver failure, vasomotor failure, and patient can lead to fail, it means death. So all these are changes. So we have to have the alert on this condition because of the burn. That's why the first of all, when the patients arrive and reaching in our hand, we have to find out and we have to assess that how much degree has been, affected. Okay, then after the degree we should see that how much layer is covering. This is we will consider in the first degree or second and third. Then we will plan for the fluid resuscitations, how much fluid has to given. So without calculation, without assessing, we will not have the knowledge to do this all care as well as the fluid resuscitation. Are you getting me? Yes.
Yes,
Now
yes, ma'am.
we all know that what all are the burn complication of burn. So okay, the patient reaches in the hospital, and that is a very serious conditions, and we want to protect from the complications. That means the burn team has to tackle up the case, and we have to do all the necessary action has been taken by the burn team. So who all are the burn team? Let's see now. Burn patients are managed with a multidisciplinary approach. Each discipline is complementary to the others, and dedicated team approach is like to successful management of the burn case. Okay, the this one first, please write it down fast. Okay, the first is the burn surgeon we need. Burn surgeon is usually a plastic surgeon or having a particular interest in the management of burn case. Okay, maybe the special or maybe the surgeon can do it this part. So based on that, based on the patient's condition, we will require. Okay, so the burn surgeon also under the burn team. Understood? Second is we nurses. This is we, as we all know that burn nurses have special expertise. We need to do wound care, then we need to do skin care, or we need for the skin grafting, and we need for the nursing care, the fluid management, then control, infection control, okay, and then the nutrition, okay, then the care, and we need to give the counseling and motivate the patients in that situations. Then in during the hospitalization, what all has to be done by the nurses, we have to be involved, as well as after the discharge also we have to give counseling that you have to come for the rehabilitation for the exercise and you need for the follow-up checkup, and we have to convince that we can do surgery, then your skin can become all right. Everything has to be covered up by the nurses. Okay, the anesthesia and the intensive care. Again, we may need we may need the seriously ill, requires a multiple surgery, and we may need to keep after the surgery. Patients may need to keep in the intensive care unit. Okay, or maybe before the surgery also we may need to keep in intensive care unit, and this all has to be done by the anesthesia. If we need to do surgery, again we are required for the anesthesiology. Okay, and the fourth is the physiotherapist and the occupational therapy. Okay, burn patient also we need to do rehabilitations. we have to take them to the rehabilitation center if there is any contracture. Okay, then we have to do the passive and active exercise, and when it has to start and how, that will be taking part by the physiotherapist. And the see, this is these kinds of burn, and the full half of the portions or maybe the whole body, and how we need to taking care again by the physiotherapy and by the whole team. Understood? This will be the emergency situation. Anytime it patients may need for the intubation, or anytime we need for the dressing, or maybe we want to prevent from the any contraction, then we can start for the basic exercise and all. And the dietitian also more important part. If the skin are injured, that means without diet cannot become a shield. Okay, so we have to calculate, we have to see the blood investigation, sodium and potassium and urea and creatinine, how much in the burn patients we have to rule out. Based on that, we have to give diet. Okay, if sodium low, then we will increase extra supplement we will give. If potassium high, then we will reduce. Which type of diet is contain potassium? Okay, and then example, this pineapple, or maybe other diet which is more contain potassium, we will reduce. That's why in hospital we have the dietitian, and dietitian will used to come and see all the blood investigation level. Based on that, they decide that what all diet has to be assumed. Okay, so we need to teach the relative, or maybe the hospital diet has to be provided. Then the psychologist to provide the psychosocial, psychological and emotional support from the very beginning, because this is totally anxiety and depressed, maybe patients may have fear, and how it's burned based on that. And so psychological support are very important. And post-traumatic syndrome, we don't want to give the post-traumatic syndrome to the patients, we want to prevent it, so we have to sympathize to them and empathize to them and give the counseling, you know so that patient will be reduced from the any mental trauma. Then social worker providing support for the post-discharge psychosocial assessment and rehabilitation also has to be involved. Means it has to be involved by the social worker. We need to give lots of informations. Okay, and if they need, even the burn patient also we need for the palliative care. Then many things can be helped by the social worker. What
Yes, ma'am.
happened when burn occurs? We all discuss, okay, what all are the complications, then what are the physiological changes, and how the skins are taking role in our body. What exactly happen when the burn is occur in our body, in when it's exposed in that situations. You know, see, burn injury to an individual result. Okay, the local response and the general response. Local response are for better understanding of the local effects of burn. We can take help of Jackson's burn wound model. So last time we discussed about the zone 1, zone 2, zone 3. Yes? Remember? Yes or no?
Yes, ma'am.
After,
Remember.
yes, after the burn, immediately the zone 1, zone 2, zone 3. And what is that name has given in the zone 1 and zone 2 and zone 3? How it's the layer is affected, and how it's becoming normal condition. Okay, see, zone 1 is the hyperemia. It is very hyperactive. You can see from here in this surrounding, this area very fresh and taking more active this zone. Okay, and then after hyperemia, then it's becoming zone of stasis, and then zone of coagulation. It may comes in the exam time also. You try to draw in this way, okay, and explain it. And you can see Zone of hyperemia, how it's come really in the skin, then stasis is coming. But in zone of hyperemia is a high chance to get skin the cell death, if we don't take care. Then zone of staging. These are the process of the healing. Then the zone of coagulation. If we are administer the drug properly, if we provide diet, and if we are taking care of the exercise, then the persons can become a normal heal in the body, in the skin. So this is the skin and subcutaneous, what all are involving. And can you see in this slide, zone of stasis is preserved. Okay, you see the zone of stasis and how it's becoming small, narrow. This is the adequate treatment, adequate resuscitation of fluid. This is the sign. Okay, and the right side, zone of stasis loss, inadequate resuscitation of fluid. Are you understand? Yes.
Yes, ma'am.
Okay, you understand from this structure? Okay, so that means that we need to care patients in time. We should not neglect it. Okay. The second slide, zone 1 repeat cell death. Okay, the zone 2. Zone 2 is zone 1, then the zone 2 inflammatory reactions. Okay. This area is, become damaged. Once in the inflammatory process reaction is occurred, then the skin will become damaged. And if we are, treat early, then that part can save. Okay. So instead of taking role of healing, it will take in the cell there, then the inflammatory process, then it become damaged, then it will be more infections. Instead of taking healing process, taking in this way, that means it will be complicated. Zone 3, widespread dilatation of blood vessel. That's why, the first of all, we need to transfuse crystalloid, then the colloid, then the blood we are systematically. Then how much fluid, we want to save that. In that is the formula and the categorized. If we infuse that way, it will be more save the patient's life. That's why, okay, everything you have to be follow that. But if they had given scenario, you have to follow. If not given scenario, then you have to write it in this point. Okay. The general response, this is for the just understanding. I'm trying to add up this point. Okay. The normal capillary exchange function. This is why it's happening. Because loss of fluid, then once fluid loss, electrolyte imbalance will come. Then if electrolyte imbalance, not only the fluid loss, it will be changes in the albumin level in our body. The circulation also will be changed due to increased permeability of capillaries. Then because why the skin damage, it also affect the circulation, metabolism, temperature control, immune, all will be changed. Okay, the function of the gut and the lungs is also affected in larger burn. That's why you have seen the physiological changes. Okay, lungs is affected, hemodynamic are not stable, everything can change. Why skin cover is important to us? Skin is the protective covering of the body. Regulate temperature of the body, helps in metabolic function. See, remember, helps in maintaining circulation, immune functions, body defense mechanism, prevent infection, give us protective sensation. Because of that only, skin are functioning these all points, 1, 2, 3, 4, 5, 6, 7 points. But once it's damaged, then everything will be compromised. Because of that only, those complications are coming. And if we understand anatomy and physiology and what are the function, then it will be understand only. This will be my last slide. And I hope everyone is understand this anatomy and physiology. I already explained in the first. Okay, so this is the part. Any doubt? And now you have learned two portion. Why? What is happen when burn occur in our body? Okay, the zone, please you remember zone 1, zone 2, zone 3. Then what all are the complication? Who all are the team? Burn team. Are you getting me? Yes?
Yes, ma'am.
All of you understood?
Yes, ma'am.
Oh, you got some point now? Okay, thank you
Yes,
so much.
ma'am.